province-wide to allow for social circles of up to 10 members. Think of your social circle as the people you can touch, hug, and come into close contact with as we continue our shared fight against COVID-19. A social circle is made up of families and friends that you can interact with without the need for physical distancing.
Ontario says it's time to expand your social circle. The Ford government says households can now expand their social circle to up to 10 people, even if they don't live with you. That's the latest in the province's reopening plan. But with provinces across Canada all taking a different approach to reopening, it's left some Canadians, and I have to admit myself included, unsure of what to do to stay safe. And when it comes to curbing the spread of COVID-19, are the many reopening plans equal? Let's make sense of it all with two experts on different ends of the country. Dr. Bogoch is an infectious disease specialist based in Toronto, and Dr. Srinivas Murthy is an infectious disease specialist out of BC, also the co-chair of the World Health Organization's Clinical Research Committee on COVID-19. Welcome to both of you, doctors. Thank you for being there. And I hope that you are going to help us make some sense of all these reopenings and the different rules, because every time there's a reopening, it is accompanied with so many different and changing rules that sometimes it's a little bit hard to sort of keep up. But I want to start with the new restrictions at the airport first. So travelers will have to have their temperature taken before they can board a flight. They will not be allowed to travel if they have a temperature. Dr. Murthy, is this one more layer of protection, of prevention? Does this make sense to you, scientifically?
Temperature screening has always been something that we've always wanted to work. And so temperature screening at borders, temperature screening at walking into buildings, it hasn't been a great tool for tracking this disease specifically and minimizing its spread. Remember that there's a significant proportion of spread that's asymptomatic or pre-symptomatic. And this screening won't necessarily help that much.
So, yeah, but Dr. Bogoch, why were we told a few months ago that this was totally unnecessary? We asked the health minister, we asked health officials that this was, completely useless, and now it's mandatory. So what do we know now that we didn't know a few months ago?
Well, not much. I mean, it's just one of those things that I think we're going to have to live with. And in all fairness, you might get lucky and catch someone with a fever that happens to be positive for COVID-19. But, as was just pointed out, many people won't have a fever at the time they're crossing the border or at the time they're about to board the plane. It's an added layer of protection. It's going to add some protection, certainly not a lot, but hopefully with the other safeguards in place, when we have that in place, it might add some small additional level of protection.
So it may be, it's to make, it seems to me from what both of you are telling me, that it's just to make, travelers feel a little bit safer, although it doesn't really make them any safer. But I want to move to these changes, to these reopenings. So for instance, in Alberta, you can have meetings of 50 people indoor and 100 people outside. Here it's 10 people. I mean, I'm not sure that I understand why this huge difference between, Alberta and here in Ottawa, for instance. I know Toronto is excluded from this, but is it safe 50 to 100 people together already? I'll start with you, Dr. Murthy.
To be truthful, I think we'll see. I think a lot of the tests will be as we start to liberalize what we can do and where we can do it. The only way of really finding that out is by tracking things very carefully, trusting our public health teams to do the tests that are required to make sure we know where the disease is, and isolating people accordingly. In BC, for example, there's a different rule compared to Alberta, and I can't say one rule is better than another province. And we'll see over the coming weeks which one works out best.
So, I mean, tracking and testing is so important, but Dr. Bogoch, we're not there yet, right? We know that the tracking is not in place yet. We know that, tests, we're getting much better at it, but we, haven't reached a point where the tests are, we have enough testing. So is this too soon, or is this a test to see if indeed the curve changes or goes this way?
Yeah, well, certainly when we're looking at capacity across the country, there's certain different places have varying capacity. So some places are much better prepared to rapidly make a diagnosis, rapidly conduct contact tracing, and have the capability to support people, the infected people or their close contacts through a 14-day period of isolation. Other places, it seems to be taking a little bit longer. Certainly, we see that almost everywhere across the country is opening up to some extent. Some places are opening up a little faster than others. And I'm sitting here in Toronto. We're sort of the ones that are left behind here in Ontario, whereas the rest of the province is really opening up. And you got to hope that this capacity to test and trace and isolate really is in line with the opening up of various economies. I certainly think that some places are more ready than others. And if you're in a place like Kenora or Timmins or Thunder Bay, where there's very few cases and there still is good capacity there, I don't see why it's a bad idea. I think it's very reasonable. But I think we've got to step it up in a few other parts of the country just to make sure everything's safe.
I want to ask you, Dr. Murthy, I know we don't have a lot of time, but about children, because we're reopening, daycare, children are going to start going out. Will they be more at risk now? Because, children were kept at home for the most part in the last 3 months. Will they be more at risk?
Yeah, that's a great question. My kids are in school right now, for example. We don't have a firm understanding as to what the burden of spread from children to adults and from children to children really is. And so there's some good data from Europe and Australia and other places that suggest that children might not be as much of a spreader as adults, but we don't really know that. And so we hope that children won't continue to propagate this within our communities. I think a lot of it depends on what the baseline level of spread in the community is when we open schools. In BC right now, it's relatively low, so we feel comfortable at reopening schools. In other parts of the country, they're not there yet.
Oh, that's so interesting, and we'll be talking about this for a while as reopenings continue. Dr. Srinivas Murthy and Dr. Isaac Bogoch, thank you both for being there.
No problem.
Have a good day.